I am just going to try and keep it quite brief, under 10 minutes. Um, Obviously, you have heard, and you'll be hearing more about art therapy throughout the course of today. So I'm really not going to speak about that per se, but I did just want to highlight a few of the standout moments in our year and to thank a few people, especially our funders, without which we couldn't do all of this, obviously. I was casting my mind back a year ago to March of last year when this pandemic was kind of coming down the tracks and everyone was getting very anxious. And I remember it only kind of lasted for 2 or 3 days, but we phoned around all of our partner hospitals just to see how they were feeling and if they were thinking it might be wise to pull the plug. And the first hospital that made that decision was Glasgow. And as soon as they made that decision, we decided that we were going to come out of all of the hospitals because obviously risk of cross-infection and most of the children we serve have weakened immunity. And I mean, it's almost laughable looking back now because Kirsty, who spoke before, our art therapy project manager, had even asked me, is there still going to be a job for her? And the irony is, we've been busier than ever. So although it was kind of a scary period, we just knew, sometimes you just know things with your knower. And we just knew that we had to do this and we had to just reimagine, recreate and move everything online and trust that that would be, it would work. So it was a very energizing time for the staff team, and we worked really closely with the art therapists as well to create resources and to really think what this would look like. And we did it with the full support of the hospitals that we were working in. Obviously, it was a big job because all our policies and procedures had to be overhauled, not least child protection with working online. But it's worked really well, and we're really pleased with what we've achieved, which is why we wanted to share our learnings today. The driver for all of this and for all of the staff team and the art therapists is always children. It's come from a desire not to want to fail the children that we serve. And that has been a very dominant theme this year. Sometimes themes just bubble to the surface. And the theme very much has been about listening to the children and the young people and wanting to have a young voices forum where they can feed in to influence and share and shape our service delivery. So that is exactly what's happening. And it was good to hear from William earlier, and you'll be hearing more a little bit later. So I did just want to say, if any of you have children in mind that you think might want to contribute to this work, then please, do point them our way. We are also going to be running in this year a PR campaign based around this whole theme of invisible illness, because so many of these children feel that they're defined by their illness, or at least people perceive them as such. And actually there's a lot of misconceptions to be kind of unpacked. So we would really like to do a campaign, and obviously they'll carry more weight if other people come in with us. You've had some insights today into some of our partners, but just so you're aware of the bigger picture, we have been working over the last year in 10 different hospitals throughout the UK, and they go from Inverness down to Southampton, and then west to east from Liverpool to Newcastle. And we've also been delighted to embrace equally 10 as well, other partnerships. And our plans now are very much about scaling up our art therapy. And this is happening through referrals from people like patient advocacy groups and other, arts and health charities, others in the third sector. So if you have a group of children who you feel could really benefit from art therapy, then please do get in touch with Kirsty and we'll look to make that happen for them. One thing I wanted to touch on, I don't want to give you the impression that it's all been, everything's gone swimmingly. It's been a year of worry and a few financial wobbles, but I'm delighted that we are ending the financial year in a position of relative strength. And I think our ability to secure funding is really a testament to the growing recognition of the power of arts and creative therapies more generally. So we're really grateful for that. So our funding, it's really clear to me that we need small, medium and large donations. We can't just be dependent on the large ones because most of our grants are for small amounts actually, but we need the bigger ones as well. So I just wanted to thank the people who've given, all told, 38% of our income has come from large and public funders this year. So they are the Cora Foundation, First Port, Foundation Scotland and the Robertson Trust. So thank you hugely to our funders. One of the things that we were hard hit by, which was such a pity in our 10th anniversary year, is that we had planned a lot of community fundraising activities and they couldn't go ahead. But we were absolutely delighted when Laura Young's eldest daughter, Nina, took on to walk the Northwest 500 route for us around the north coast of Scotland, and in doing so raised 20,000 and secured quite a lot of media coverage, which was just so helpful. So huge thanks to Nina. We are now obviously trying to kind of re-galvanize support in that area, and we have a lot of information now on our website about our community fundraising work going forward. So that was really all I wanted to say. Enjoy the rest of the day, and please do connect with us if you would like to point people our way, or if you'd like to talk about working with us. Thank you so much.